we are going to look into vaccination and health emergencies that we have active currently. We're going to see how we are doing in the Americas in general. This is a look at the general vaccination situation, and this picture is not just random. When we're saying that vaccines save lives, this is something that we may have forgotten, but it is important. We have achievements, and the Americas was a region that opened up the field and taught the world how to eliminate many of the viruses that are currently, again, threatening with attacking us again. And when we are saying that vaccines save lives, I think that this is key. And fortunately, we did not have to have polio outbreaks, kids, children that died due to measles, which was the norm in the past, and vaccines save lives, and we may have forgotten that. And we don't have to face polio consequences anymore. This slide shows us a trend line. You can see that from 2020 to 2021, the various regions in the world are organized according to WHO, and you can see here that the purple line is the line of the Americas. This is what they call UMRO. And you can see that in 2000, we were almost first in the ranking of the areas that had the most vaccination. Here you can see the areas that have the third dose of DTP. This is one of the vaccines that we use the most to assess the progress made in vaccination. And you can tell that our goal in the Americas is to reach 95% or higher. And right now, you can see that the cases by PAHO and UNICEF, this is at 80%. And what has happened with the Americas? That is the big question. What has happened with the vaccination programs? And you can tell that this represents in 2021, 2.7 children younger than 1, that is to say 19.7% of these children that did not receive all of the vaccine doses. These kids are vulnerable to severe diseases such as tetanus, measles, diphtheria, and you can see the horizontal color bars that you can see at the bottom of the graph. And in 2020, you had other 2.7 million children that were under-vaccinated. So if we go to 2019, you have an additional 3 million, and if we look at different years, you have to keep adding millions of children that are not vaccinated. So this requires a very integrated effort among the various sectors. This goes beyond health sector. As we have seen with COVID, these are diseases that have an impact on all of the sectors, on all of the segments of the population. This is key to understand what has happened in the world and in our region in particular. Then, when we break down the various types of vaccines, some vaccines protect against different viruses. This is a vertical bar graph that shows us a summary of the situation between 2016 and 2021. This is not a trend for BCG, that is the vaccine that protects against tuberculosis or measles, mumps, and rubella. You can see that the trend is similar. There continues to be a concern because it is not just one disease that is making our children vulnerable, but more than one. And at this point in time, I would like to mention to you that if you know of any acquaintance that has stopped vaccinating their children, think of a friend, a family member that because of the pandemic said, I am afraid to leave the house, then the vaccination schedules for children are lagging behind. Bear that in mind. What we are seeing right now is becoming more and more frequent. Let's move on to the next slide. These two graphs show us the number of children to the left of the screen that have not even a single vaccine in 2021. That accounts for 14% of all of the children in the Americas. That is the rate of unvaccinated children in the Americas. And you can tell that there are some countries that because of the number of children and also the extent of the population and also the birth rate, that accounts for a greater rate, such as the case of Brazil, Venezuela, Mexico. But what is the other side of the coin? We see that the 14% of the children or 19% of the children that have not been vaccinated, we need to add an additional 5% to follow up. That is to say, you already identify the child because one or two vaccines, depending on the vaccine we are referring to, may not be enough to protect for the defenses to be strong enough to say that the child is properly protected. So the one on the right tells us that an additional 5% of the unvaccinated children are under-vaccinated. So we end up with 19% of children that are not vaccinated in the best possible manner. And this is using DPT-1 and DPT-3. So if you look to the left, the countries that are there represented are also represented to the right, but we see that the percentage increases in some countries and for those that were represented on the left. All of this takes us to the situation of the current pandemic, whereby the vaccines became key actors. You can see the number of cases that were confirmed here in the Americas this year, 178 million of confirmed cases. It is an incredible number of cases. And you can also see the number of deaths. We're talking about 2.8 million people over a 2-year period. This is an incredible number when we compare this to the other diseases, to the other situations, diseases that may lead to death. COVID is a record disease, and please accept my condolences because I know that there are individuals here connected today that have experienced the loss of a family member or someone close to them. But there is something important here, vaccines. And here we see the progress made in terms of COVID-19 vaccination. The number is record here this is a record number here in the Americas. If we start to vaccinate we started to vaccinate in 2021 on a continuous manner. We have been during a pandemic over 2 years, but we started to have the possibility to have access to vaccines that is a little bit over 1.5 years. So we see that we have there 2 billion vaccines that have been administered in the Americas, an incredible number. And also the effort by the countries has been incredible. We also see to the right, 70.1% is the rate of vaccinated individuals with full schedules in the Americas. and in the Caribbean. And that is a percentage that, according to the WHO, is the minimum threshold. And we attained that already in the Americas, but that also takes us to the next topic. And we see that there are still 210 million persons who have not received not even one single dose of the vaccine in the Americas. And among those 210 million, it is important to understand that there are individuals that are susceptible to severe disease and to death. So we still have an important debt, 210 million people that we still need to vaccinate. And when we look at the percentage, I would say that as a region, we have already overcome that threshold. But when we look at the overview, we see that the situation is not as even as we would like. We have 16 countries that have already overcome that threshold, the 16%, the population that can get vaccinated. But we see an important number of individuals, 70, an important number of individuals that are, or countries that are below 70% and even 40% of the vaccination threshold, in particular in the Caribbean. But that 70% threshold has been reached in most countries. There you can see some variance in the colors and of the bars, and it shows these are the reports we receive from the countries. We also see that some countries have stopped sharing their information on the numbers of vaccinated individuals. And this other graph tells us that as of October last year, the countries and territories of the Americas are administering, you can see here the light blue bars, primary doses, that is to say, full schedules. And as of October 2021, we started to see that the country started to progressively vaccinate with more boosters. I am not saying that this is bad. We need to attain that, in particular among the most vulnerable individuals. They do need to have their boosters. But this graph also shows us that the number of individuals that have 0 dose is not decreasing. And we have seen that already, 210 million individuals. But when we do the week-to-week follow-up, we do not see a significant reduction. That is to say, the countries have focused more. And I know that there have been several barriers to get to some percentages of the population with some primary doses and with the full schedule. But what this is telling us is that we need to try to have those light blue bars grow. So this has been a very important challenge to reach those thresholds. But whatever we do with those 210 million people, there are many individuals among those that do have underlying diseases that may end up with the death of these individuals. This is the breakdown of vaccination coverage by subregion. Here in the Americas, you can see how we tried to divide it into full schedules. That would be the light blue bars that have at least 1 dose. These are the percentages in orange that shows at least 1 dose, and then in gray, 0 dose. So you see that the southern cone is the one that has the highest rate, the highest coverage, 78.9, followed by the Andean region, then North America, and the Central America, 58%, and then the Caribbean between 40 and 52%. And so we see how this is increasing also in terms of unvaccinated individuals. This is the graph to the left. Now, on the right, what we see is the breakdown based on income levels. So we took all of the countries and we see the income level. The countries that have the highest income have barely more than 70%. And when we look at the countries that have a lower income level, middle income level, we see that their performance has been a little bit better with the full schedule, not so much with the booster. But when we start having lower income, we see a significant reduction. When we look at low-income countries, 47.7%, that is quite low. And that should also be a call to try to understand what happens in these countries in terms of vaccination, and also in connection with the pandemic that implied that they would have lower coverages as compared to other countries. We do know about vaccine access. Higher income countries did have access sooner than others. Now, to conclude, I would like to refer to COVID-19 vaccination and boosters. The individuals that have not been vaccinated do need to receive the full schedule. When we're talking about AstraZeneca, Pfizer, or Moderna, the basic schedule starts with 2 doses. So when we're talking about boosters, that is to say, the immunological system already has a basic defense level, then we do need the boosters. So when the immunological system starts to decrease in terms of its capacity to protect itself, the booster fine-tunes the system. So we know that the highest priority is for 70% of vaccine coverage with the primary series is attained. And when we're talking about the high-risk groups, we would need 100% of those individuals to be vaccinated with the first doses and then with the booster. We have 4 bivalent vaccines with the mRNA. And what does it mean that they are bivalent? That means, or bivalent, that means that they do have the component of SARS-CoV-2, the virus, but also they have included the Omicron variant that is the one that has caused the most problems, that is the prevailing one. And you see there BA1, BA4-5 in combination with that ancestral virus. And it is important because current evidence tells us that these bivalent vaccines that have been available for a very short period of time may not be used as the primary dose. The primary dose should always use the original vaccine, the one that was used in 2021, then in 2022 for primary doses. SAGE, that is the highest ranking group in terms of vaccine advisory services, indicate that the vaccines available are not enough, or the data available is not enough to recommend the booster for the bivalent vaccine. What it's telling us is that for those individuals that do need a booster, they need to use the vaccine that is available in its original form or the bivalent form. It doesn't matter which one it is, but the booster needs to be applied when needed. And this is clear. And now as to children, we see that children may be vaccinated starting at 6 months. And this is by using the pediatric version of booster of the Pfizer and Moderna vaccine. So they can be vaccinated starting at 6 months. And then also children and teenagers younger than 18 years of age with comorbidity should also receive all of the COVID-19 vaccine doses. I know that some of you are going to ask me, we heard that children do not get sick as frequently, but it doesn't mean that they never get sick. So there is we have seen a multi-systemic syndrome that only affects children, and we have seen also children with severe situations in the emergency rooms, in intensive care units, at the hospitals. So we always need to try to reach this population, and it is important that there is no recommendation by PAHO to vaccinate with a booster children under 12.
Now, some words about monkeypox, and the Director General declared in July that there was growing involvement by people in monkeypox. So it became a disease of concern in the world. The vaccine is not the only measure. It is complementing other measures which continue early detection, and also following other public health measures and tracing contacts. So nobody has said to this point that there is an indication for mass vaccination against monkeypox. The advisory group of PAHO has said that vaccine should be offered to close contacts of people infected with monkeypox. So that's the group who should be offered monkeypox vaccines. And again, it's just a complement to other things. And you need to assess risks and benefits almost case by case. It is a different kind of vaccine when we talk about polio, measles. We have broad defined groups, but in that case, we're talking about mass vaccination of a cohort of children. But here, this is very specific, very particular. We also know that there is a limited stock of this vaccine and that it is very expensive. So we need to consider all of this. Post-exposure vaccine within 4 days of exposure can be considered by some high-risk countries. Thank you. Now, a few words about polio. Polio, we just said goodbye to polio in the Americas many years ago, but at this point in time, our coverages are low. You saw the coverages of DPT-3, 80%, polio, 79%. It's a little less, so it's worrisome. We have a group of children who could come down with polio if they are exposed to the virus at this point in time, and that is high. So see what happened here in the United States, and you've already perhaps participated in giving information about this disease. There was a man who had not been vaccinated and came down with paralysis. When you develop paralysis, it means that there are many infections around you, up to 1,000. So what this tells you is that there have been infections in that area. And also the other point in this case was that if you go to wastewater, you can find polio, and this means that it is circulating. This virus has been in the environment and is in the environment, and this also weighs, and it is also related to other similar findings of circulation in also circulation in the UK and Israel. So it's a very close virus that is circulating in other places. So 30 years, the Americas was the champion. We said, yes, we can. And we became the first region in the world to eliminate polio. But right now we're suffering because we have low coverages and because there is a situation where surveillance and the capacity of children to have sharp teeth and be out there detecting timely detecting suspect cases, this has also decreased, and this worries us, and it calls us to act more actively. polio has no cure. Once a child develops paralysis, there's nothing we can offer them to revert that paralysis. It's permanent. But the vaccine is highly effective to prevent this paralysis, and it should be a full schedule, and it grants life protection. Once you complete your schedule, it is for life. We have had 2 countries considered high and very high risk of suffering from an outbreak. When we have one single case, you already consider it to be an outbreak. About 2 weeks, a resolution was passed at the end of September for responding more quickly, because we need to act quickly to defend that achievement and keep our region free of polio. Next one, please. And so this is my last slide, and I would like to emphasize that in order to have public health, to be able to improve the health of our peoples, the connection between information, health, and the community is key. And you, all journalists are important, very important, to convey information as clearly as possible, as accurately as possible, as responsibly as possible, as in a timely fashion as possible. Without you, the communication with the community would be harder. Journalists participate in creating an opinion, informing an opinion, and you're partners in conveying information. So your role is defending the health of our communities, our peoples, and it is a significant role. And you also make decisions or you contribute to decision making by the population. What people see on the media is so clear that they will make decisions, very important decisions with respect to their health after reading or seeing something on the media. So you have an important, more than an important and heavy role to play to pass along information that is based on evidence. When we start passing on information without scientific evidence, or if we pass around an alarming piece of news, but which is not based on science, it is an irresponsible way to communicate. So it is important to communicate in a simple, timely way, accurate and based on evidence and facts is part of your important role. And we also praise those journalists who consult good resources, because resources need to be reliable. If media consult accurate resources, reliable resources, then of course that gives you clout with the people. So all these points that we have here are key, and they make a difference. So those of us who are trying to build public health hope that journalists and media fulfill that role, and hopefully in a continuous manner. Thank you very much.